Hi, my name is Mindy Butler, and today I'm going to present my IFCS Capstone project, developing a childcare navigation toolkit for families in Northeast Tennessee. This project was developed in partnership with the Population Health Department I work with to help some of the families out there, and it focuses on addressing barriers to childcare access that impact family stability and economic well-being. In addition to the research presented here, my professional experience working within Ballad Health's Population Health Division has provided direct insight into these challenges at the community level. Through my role, as well as through collaboration with coworkers and partnering agencies, I have consistently worked with families and caregivers who experience significant barriers to accessing childcare. These challenges are not limited to affordability or availability, but extended difficulties navigating childcare assistance systems, particularly programs such as Families First and Smart Steps here in Northeast Tennessee. Families frequently report confusion regarding eligibility requirements, required documentation, and the application process itself. Even when families qualify for assistance, delays in system complexity often prevent timely access to services. Not to mention, the website that DHS has is very confusing to navigate for families. These lived experiences align closely with the research, which highlights childcare barriers in rural regions are not only structural, but also administrative in nature. This combination of empirical evidence and professional observation strengthens the rationale for this project and highlights the need for practical education-based solutions that improve accessibility and understanding of available resources. So in addition to the childcare specific barriers, families in rural Appalachian communities experience broader structural challenges, including persistent poverty, a limited economic opportunity, and reduced access to resources. From a theoretical perspective, this project is grounded in ecological systems theory, which emphasizes how larger systems such as policy, community resources, and economic conditions directly influence family functioning. When barriers exist with these systems, they can disrupt multiple areas of family life, including employment, stress levels, and overall well-being. This model illustrates how childcare barriers create a cycle that it impacts family stability. When families cannot access reliable childcare, it leads to missed work or reduced hours, which then contributes to employment instability and financial stress. From a family systems perspective, this cycle demonstrates how one barrier can influence multiple areas of functioning within the family. So if you start right here, you have your childcare shortage, and then difficulty securing reliable childcare equals missed work or reduced hours, employment instability, then financial stress for families, and then the family is back to square one, starting all over again. So in response to these challenges, I developed a childcare navigation toolkit designed to support families in Northeast Tennessee. This project is grounded in a family life education approach, meaning it focuses on prevention and education rather than clinical intervention. This toolkit was presented to strong family staff who work directly with families experiencing economic and social barriers. This project is also innovative in that it translates complex policy systems into clear, practical tools that families and staff can use in real-world settings. And this was the first page of the toolkit, which I will include in my uploads with this. The goals of this project were to improve access to information and reduce barriers related to childcare navigation. Specifically, the project aimed to improve understanding of child care assistance programs, simplify application processes, provide clear guidance in eligibility and documentation, and help families locate child care providers. This project aligns with CFLE competencies, particularly family resource management, by helping families access essential services and family life education methodology by providing accessible, easy to understand information that supports informed decision making. So this slide outlines the development process and the progress made throughout the project. The bolded text represents the steps I completed each week, including conducting a needs assessment, developing the toolkit, and preparing my presentation. So the red text highlights the challenges and modifications, such as simplifying policy language, adjusting my approach to provider resources, and expanding the toolkit to serve all caregivers rather than only single mothers. This process reflects an ongoing responsive approach to both feedback and community needs. So overall, the development process was collaborative and adaptive. A major strength of this project was the support from strong family staff leadership and the family partners, which ensured the toolkit was grounded in real community needs. So challenges included limited specific research and the need to simplify complex policy information. And these were addressed by using broader rural research and applying a plain language approach. This process highlights the importance of flexibility and responsiveness and family life education practice. So participants, this project involved collaboration with key stakeholders, including the population health director, family partners, and community health navigators in our region. And their feedback provided valuable insight into common barriers such as childcare access, employment challenges, and lack of support systems. This served as an informal needs assessment, and it directly informed the design of the toolkit. So this approach reflects a family-centered and community-based model of program development. So the evaluation data. To evaluate the effectiveness of this project, both qualitative and practical measures will be used. So evaluation focuses on increased understanding of childcare eligibility, improved confidence in navigating systems, and successful completion of applications. These outcomes directly align with the project goals of reducing confusion and improving access to childcare resources. Data will be collected through brief family feedback surveys, staff observations, and ongoing program feedback. So feedback from staff highlighted consistent themes they encounter daily with the families they serve, including confusion about where to begin when applying for childcare, looking for childcare assistance, understanding eligibility, and challenges maintaining employment due to unreliable childcare. These insights reinforce the need for a clear, accessible resource. While the toolkit provides a strong foundation, future improvement could include expanding digital accessibility, incorporating multilingual resources, and providing additional staff training to enhance implementation. So some of the feedback, I got so much feedback, and these were just four of the most common areas of what they were saying was families often don't know where to start when applying for child care assistance. Many parents struggle to understand eligibility requirements. Transportation and lack of reliable child care are a major employment barrier. And this will be so helpful for a caregiver to see this information in simple terms with clear direction. So the final toolkit structure, the toolkit was designed to be practical, accessible, and engaging for families. It includes checklists, step-by-step guides, and simplified language to support a range of literacy levels. Materials are available in both digital and printable formats, making them adaptable for different family needs and access levels. So in conclusion, childcare access remains a significant barrier to family stability in rural Appalachian communities. This project provides a prevention-focused, education-based resource designed to improve access to information and reduce navigation barriers. By supporting families in accessing childcare resources, this toolkit has the potential to improve employment stability, reduce stress, and strengthen overall family well-being. Additionally, this model may be adapted for use in other rural communities facing similar challenges. And these are the references that inform the development of this project. Like I said, references for this specific region were very hard to come by. So I did was able to pull these plus several more, but these were the top ones. So thank you for your time and consideration, and I welcome any questions or feedback. Thanks so much.